Finding Your Way with Ocular Melanoma, join me, host Tara McCannell, as I share with you everything that I know about this rare cancer. I hope to get your questions answered and empower you to live your best life. Please visit my resource page, sayhart.com/ocular melanoma. That's SEYHART.com/ocular melanoma for more content and support. I encourage you to subscribe. I do these episodes twice a week so that you can be on top of any information that may be relevant to you. Please leave reviews, share with friends. All this helps others who are looking for information find us more easily. Today's topic is newly diagnosed with ocular melanoma, what to do in your first 30 days. First of all, you may have been told that you might have an ocular cancer. Is this you? Let me tell you a few things that you need to do before you let your emotions and fear and uncertainty take over. If you've seen an eye care provider and they have found something that looks suspicious, a bump, a freckle, an unusual mole, a strange retinal detachment on a photograph that isn't really clear what it is, please pause, take a breath. The very first thing that you need to do is to confirm what it is. The majority of people who come to my office, I'm an ocular oncologist, for the first time, don't actually have an ocular cancer. But there was enough suspicion by the person who referred the patient to see me that they didn't want to miss that possibility. We don't want to miss cancer because cancer can be treated. So first of all, don't get yourself get emotionally overwhelmed until you start the process of sorting this out. So how can you know that this might be an ocular melanoma? You need to see an ocular oncologist. An ocular oncologist is an ophthalmologist who has experience dealing with lumps, bumps, cancers, and treats cancers in the back of the eye. So make sure that this is the kind of person that you are being referred to. Chances are that you have seen a retina specialist, and most retina specialists are very skilled at knowing if something is concerning or not. And a retina specialist will often ensure that you see an ocular oncologist. If you've seen a retina specialist and they say that there's something that looks suspicious and they'll just monitor it, you always have the option of asking to see or asking to be referred to an ocular oncologist. Or you can just look up ocular oncologists in your area and go ahead and make the appointment yourself. Sometimes it's nice to be reassured and be seen by a person who has a lot of experience with ocular tumors and have that be the situation where you achieve relief. Like you know this isn't a melanoma because the ocular oncologist helped to reassure you. Getting additional appointments outside of what you normally have been recommended is completely reasonable. And why? Ocular melanoma, ocular tumors that are unusual, these are very rare conditions in the eye. And in fact, most ophthalmologists who practice general ophthalmology, who do cataract surgery, they have never seen an ocular melanoma in a patient who has walked into their office. The majority of people practicing haven't even seen this in a patient. So, because it is so rare and uncommon, it is necessary to get several opinions to help reassure you to know what you need to do. So, make sure that you see an ocular oncologist and get reassurance and confirm that this is what it is or not. And I want to take this a little bit further. Sometimes, in fact, many times, I recommend to patients it may be helpful to see more than one ocular oncologist. Why would you need to see more than one ocular oncologist when an ocular oncologist is sort of where the buck stops? This is a person who has experience, who would treat you, etc. The reason is most of the ocular oncologists who are practicing medicine in this country have fewer than 5 to 7 years of experience. So there's a variability even among ocular oncologists. So even if if the ocular oncologist that you've seen feels that this is really a clear-cut case, this is a cancer, we need to treat it, there's nothing wrong with getting some additional opinions, because additional opinions will also help you learn more about this cancer. You've never heard of this before, you're thrown into this. What you need is information. You need to understand what's going on. You need to understand any options that you have. And you can get that information most reliably by meeting with specialists who have experience in this field. And I recommend getting a couple of opinions. Melanoma of the eye treatment has significant consequences. You can lose your vision and you can even lose your eye if someone decides that you need to have your eye removed. These are very drastic opinions. And as an individual, as somebody who is going to advocate for myself, I recommend that you see several people to confirm what you have been told and also to maybe select the doctor that you feel most comfortable with. Medicine in 2025 is not like it was decades ago, where you just did what the doctor said. No matter what the doctor says, you'll just do it, you don't question. Medicine isn't like that now. There is so much information out there, and there is a lot of data that shows that the more patients are informed and understand their condition, the treatment plan, what to expect, the details of how treatment works, the better people do. And ultimately, as someone who is in the healing space and I want to see my patients thrive and do great, getting as much information is really important. So the first 30 days of being diagnosed with ocular melanoma, to summarize, starts with confirming that what you have is cancer or confirming that what you have is not cancer. And as I said, most people who come and see an ocular oncologist for the first time may not even have anything malignant. The second part is if you've been diagnosed with an ocular melanoma or a cancer of the eye, make sure that you get multiple opinions, because there is variability in the experience of ocular oncologists in this country. Long ago, there used to be maybe only 4 or 5 people who did this treatment. Today, there are dozens of people who are trained in ocular oncology and who treat eye cancers. However, the experience between individuals is different. So, get several opinions if a person has told you that you have ocular melanoma. So now you're along this journey. You have been diagnosed with ocular melanoma. A treatment has been suggested, and you're wondering what to do next. Let's focus on preparing for your treatment, preparing for surgery. Almost always, treatment of melanoma of the eye involves some kind of surgical intervention. And it may be surgery that you save your eye and the tumor is treated with radiation, or it's surgery where you lose your eye and the tumor is treated by removing the eye from the body. The reason we would do removal of the eye is usually because the vision is extremely poor at the time that you've been diagnosed, or the melanoma is so big that it can't be treated. Make sure you understand why your doctor is making the recommendations that you have been given. So the next phase of what you need to do your first 30 days is to learn as much as possible. Understandably, it's not possible to learn every single thing there is about this cancer in just a few weeks, but there's plenty of information out there that you can use to really enhance what you know and really get you to be an informed participant in this treatment journey. And so that when your doctor makes comments and sees you, you understand exactly what that means. And as I said before, there is plenty of information out there on the internet that's good and solid, so you can learn about the eye. How does the eyeball work? What are the structures that are undergoing treatment? What are the potential side effects, and what parts of my eye may be affected? That is all information that you can learn from the comfort of your home, just sitting in front of your computer. That information is available. So take some time to learn, read, Have a sheet of paper next to you, write down questions, because usually when you get the information about how this is going to be treated, what's going to be done, it's so hard to retain it all because it's information overload. There's so much to absorb. So when you go away and you have time on your own, write down questions and think back to what your doctor said would be involved in treatment. And what you can do is, once you've educated yourself over the next week or so, you can then have additional questions answered so that you have a better understanding. Now, I mentioned you may have a few weeks because usually it takes anywhere from 2 to 4 weeks to prepare for surgery to build a brachytherapy plaque so you can have treatment. I want to emphasize that you should never feel rushed into having this procedure. Treating melanoma is not an emergency like treating a retinal detachment, where with every passing day, the visual improvement and outcome may be less. Melanomas grow very slowly. Even in very big tumors, we don't see much change in a couple of weeks. And people who have medium or smaller tumors, it can take 4 weeks, 5 weeks to see much change at all. And if you have a very small melanoma, sometimes we see no change in even 6 to 8 weeks. So know that treating melanoma is never an emergency. You never should feel pressured to have your treatment. If you are feeling pressured, acknowledge that observation of yours and think twice. Maybe you need that extra opinion or have another set of eyes review the situation, because people who practice ocular oncology know that melanomas are not rapidly growing things. You do have up to a couple of weeks to get things sorted out and to prepare for your treatment. So what I always recommend people do is, if treatment is recommended, get it scheduled. But while you're waiting for your treatment and doing your learning, this is your time you can get additional opinions. So you can get an opinion and you can always let the doctors know that, I'm being scheduled for surgery at this place, but I know that it's important for me to learn as much as I can. So I'm here for a second opinion and I want you to tell me what you would tell your patients. And that's how you do your learning. And you can decide whatever you want to do at any point. Even if you've already made a plan to have surgery at one place and you meet somebody in your journey of second opinions, you're like, I really like what they recommend. You are the patient. You can choose what you want to do. If you want to cancel your surgery at one place, you can do that. And I want you to re-emphasize again that never feel pressured into going forward on a certain path. It needs to make sense to you. Your doctors need to be able to communicate with you so that you understand what the best option may be. So it's never an emergency. You do have a few weeks to learn as much as you can, get your second opinions, write down questions so that when you show up for the eventual surgery that you have as much understanding as you possibly can under your belt. And going in with this attitude gives you so much more certainty and confidence. It really helps reduce fear when you know what's going on. And I want to also give you some options to think about this. Normally, and I would say in most cases, when a person is diagnosed with any type of a cancer, it can be very derailing. It's usually something you don't expect, and it can be a real catastrophic moment. However, you don't have to view a cancer diagnosis this way. Another way to think about it would be that, hey, I'm living my life. Certain things happen to people as they go through life, and cancer is just one of them. And cancer is very manageable. We have a treatment for ocular melanoma. There are different things that can be done, different ways that you can be monitored so that you can be successfully treated. So I encourage you to consider reframing how you think about this whole experience. The more you understand, the more you view getting a diagnosis of ocular melanoma as a manageable health condition that there are good treatments for, that people have years of experience in treatment, the more you can gain control and move forward. You know, I always tell people, I don't want your life to be about, being a patient with ocular melanoma. This is just one thing, and it's our job to help you continue on your journey, to do the things that you enjoy, to get you back to doing activities that you like and that are meaningful to you. So, I hope this was helpful and that your first 30 days of being diagnosed with ocular melanoma can be filled with moments of learning, empowerment, getting opinions, feeling like you know what is going on so that you can move forward and be well treated. Thank you very much.